For the whole month of June, we're going to dwell with different types of sexual activity and addictions, and whether there are any scientific basis to it and whether there's any treatment to it. And the first episode, we're going to talk about addiction to sex. In a simple manner, sexual addiction actually is defined as the compulsive desire to be involved in sexual activity despite negative consequences. Some people think this is purely an extension of any form of addiction, like drug addiction. And some people believe that there is one specific addiction that is related to the actual sexual behavior. So, animal studies has been done that is noted that there's certain part of the brain actually is enforcing on that reward system. So therefore the pleasure and the satisfaction gained from sexual activity that actually continuously getting the animal to be alert and to be interested in sex. So it's an intrinsic kind of like mechanism. Does it translate to human? Well, sort of. In many parts of the research, actually is highlighted that is dopaminergic activation, which actually activates the reward system, which is similar to animals. Obviously, we cannot translate the rat model to human, especially when 80% of the actual people who are believed to have sexual addiction are actually men. So therefore, we will dwell into it a little bit more differently. 3 to 6% of the general population is believed to have sexual addiction. The reality is that when patients come to see us as clinicians, if there is a disparity between the need of the husband and the wife, then there is a problem. If that repeated addiction and repeated desire to engage in sexual activity is resulting in relationship drifting apart and resulting in the men started having high-risk behavior that will affect their relationship and the family life, obviously this needs treatment. In the States, there are support groups, there are counseling groups that will help men and women, of course, to overcome such compulsive behavior. And therefore, organizations such as Mayo Clinic that actually consider this as a portion of obsessive compulsive behavior will organize support groups and counseling in order to withdraw men and women from sexual addiction. However, the reality is that when open communications between husband and wife in order to meet halfway of their desire is probably better, if necessary, with the moderations or mediation between the couples by the healthcare professions such as psychiatrists or psychologists, obviously will be better. For the following week, it will be interesting to look at another form of addiction and how it can cause negative consequences to the bodily health. So if you think you are addicted to porn, or if you think that your friend is addicted to porn, then you need to stay tuned for next week's Putting Dr. G on the Spot.